Chapter 4 talks about what we do at the scene to find out what is wrong. And the first thing we have to do is assess. An assessment is a sequence of actions that help determine what's wrong. There's a primary check, and you have to determine whether or not there's an illness or an injury, whether the person is responsive or unresponsive, and if there is a life-threatening condition present. So with an injured person, and if they're injured and responsive, there's certain questions you're going to ask. If it's an ill person, if they're responsive, there's certain questions you're going to ask. But obviously, if they're unresponsive, they're not going to be able to respond to those questions. So you have to do certain types of primary checks and physical exams to determine what the issue is and know how to proceed. So performing a primary check, performing a physical exam, and obtaining a person's sample history is very important. First, you have to size up the scene. Look for hazards. If there's any violence, observe if there are any weapons on the scene. If there are any hazardous materials, or if the scene appears hazardous, do not go in. You need to reduce the exposure to any of those type of elements. Determine whether the problem is an injury or an illness. If it's a life-threatening condition, you need to react immediately so that you can avoid death and dying. You have to see if the person is responsive. Do they have a circulation, a pulse? Are they breathing? Is there any severe bleeding? Form a first impression. And by that, once you're looking at the person and you realize if they're injured or ill, if they're responsive or unresponsive, are they breathing adequately? Are they able to talk? Are they bleeding profusely? Is there a chance of exposure to any type of body fluids or blood? Is there a danger to you, to the injured person, or any bystanders? When you're checking responsiveness in your primary check, tap the person on the shoulder and ask, "Are you okay?" If the person does not respond, call 911 immediately. If you cannot detect breathing, begin CPR. When you're checking for breathing, look for chest movement. Listen for normal or abnormal breath sounds. Look for cyanosis. In other words, are they turning blue, or is their skin gray or pale in color? With the breathing sounds, listen if it's a snoring type of sound. Sometimes that can mean the airway is blocked. Or gurgling sound, that could be fluid in their throat. If they're wheezing, they could have a partial obstruction, or it could be an asthma or emphysema type situation. And if they're gasping for breaths, this is known as agonal breathing. It could be that their heart has already stopped. So understanding that will allow you to determine what type of treatment you need to give. When you're checking for severe bleeding, look for the amount of blood around the person, on the person's clothing, and immediately could start to control the bleeding. Of course, you need to be wearing exam gloves when doing this. Position the person. Most people should not be moved unless they're in an unsafe location. If the person is face down and needs CPR, if they have difficulty breathing because they're vomiting, or if the first aid responder has to leave to get help, if you see signs of shock developing, these are the only reasons that you would move a person. Otherwise, moving could cause more injury. If a person is unresponsive, you need to place them in the recovery position. And you have to do that by kneeling next to the person's side, straighten both of their legs, place the arm that's nearest to you out away from the body. Bring the other arm across the person's chest, grab and raise the far knee until it is bent. Grab the person's bent knee and shoulder and roll the person toward you onto their side. Adjust the top leg so that both the knee and hip are bent and at right angles. Keep the top hand under the person's cheek. So these are your basic things to do when you are at the scene, and in the remainder of the chapter we'll continue and finish up with chapter 4 shortly.